Minoxidil tablets and PRP therapy. Hello, my question is about minoxidil tablets and the platelet-rich plasma therapy for the diffusive hair loss in women. Benefits and risks. Thanks in advance.
Thank you for your question. You submitted 2 photos and you're asking about minoxidil tablets and the use of platelet-rich plasma for the elusive treatment of women's hair loss. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a non-surgical alternative to hair transplant for men and women with thinning hair. And in fact, we use platelet-rich plasma as part of the TrichoStem Hair Regeneration system. I've been doing this work for several years in developing an option, an alternative to transplantation and the standard treatments for hair loss. So I can certainly give you some perspective on how I manage patients, in particular women with hair loss. So let's begin with just the question of minoxidil tablets. Minoxidil was originally a blood pressure medication, and it was from a letter to the New England Journal of Medicine where it was brought to the attention that a side effect was hair growth. So minoxidil for hair loss for women currently is a topical solution of 2% as well as 5% as an option. Now, minoxidil appears to prolong the growth cycles of thinning hair, but it doesn't stop the progression of hair loss. Now, where does PRP therapy fall into this? Well, PRP alone, in my experience, and I have a lot of experience, I've seen is basically a short-term burst of growth with platelet-rich plasma with the injection. However, platelet-rich plasma alone doesn't seem to sustain and stop the progression of hair loss. In other words, not when I say sustain, I mean sustain growth. We use platelet-rich plasma a lot in our practice. In addition to hair loss, I use platelet-rich plasma for acne scars, for fine lines and wrinkles, for dark under eye circles, for keloid scars, for our hypertrophic scars. So we have a lot of experience. What we do in our practice is something called hair regeneration. And this is where we combine platelet-rich plasma with a material called extracellular matrix. This treatment was derived from a system that we were developing to help hair transplant healing improve, and from that the discovery that in male and female patients we can stop the progression of hair thinning, we can reactivate hairs that are not growing, and we can initiate the process where thinning hairs shed out and thick hairs grow in. In our practice for several years that we've been doing this with more than 5 years of data, looking at our patients every 3 months for many years, it appears that more than 90% of women with pattern hair loss will see an improvement. And that has been a tremendous benefit, because prior to our system, the only options for women was topical minoxidil and hair transplant surgery. And the challenge with hair transplant surgery and for women is that when you have more diffuse thinning, there's still a lot of hair. And when you place the grafts, it takes a lot of hair to create density, as well as to compensate for some of the natural loss of existing hair from the area where the transplant is being performed. It's often referred to as collateral damage, where we know that in a given area you have to make hundreds of little holes in order to place the grafts. Well, those holes are in places where there is existing hair. With hair regeneration, those existing hairs grow thicker. So I think that platelet-rich plasma alone is not adequate to treat pattern hair loss. And it's not just from our experience. Patients come to us from all over the world and describe platelet-rich plasma treatments that they've received in different scenarios. Many have come to us after they were going for monthly injections. And after a few months, they felt like they didn't see an endpoint on where these injections would end. I mean, if you have to go for a set of injections every month into the scalp, that's difficult to sustain. With our treatment, we do one injection, we follow our patients every 3 months, and then for a subset of patients, we've been seeing benefit in doing another injection in 12 to 15 months. Every patient is individual, and there are definitely some trends, but we're very meticulous about our follow-up. We see everybody every 3 months. We follow them with digital photography and microscopy to really get the details on how they're responding. In our practice, most women see a significant enough improvement that they can actually see the improvement by 9 months and often after 12 months. But in a lot of cases, we actually have patients who see women short hairs growing across the frontal hairline in the first few months. It just depends on that individual's pattern. So I think you need to learn more about your options. I would not say that PRP is necessarily the right thing. In fact, with the photos you submitted, it's hard to really determine whether or not you have significant hair loss. But since that photo is just one moment in time, you may have had more hair prior, but a proper evaluation is necessary before diagnosing pattern hair loss. It's very common for women to have something called telogen effluvium, which is often a stress-related hair loss marked by a lot of shedding. So I think you should meet with the doctor, get the proper diagnosis, and then learn more about the options I described, and hopefully you'll be able to find a solution that works for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.